another exciting day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, one of the co-hosts of your program, The Physicians, and of course, with my usual co-host.
My name is Dr. Martina Agberie. Welcome to The Physicians, where your health is our business.
So today we're talking about ectopic pregnancy. Generally, an issue that can arise, in women when they're expecting to have babies, but of course, the baby will grow out from the usual uterus, what people call the womb, in other part of the, the reproductive system, the fallopian tube, cervix, and all that.
Okay.
What any story regarding ectopic pregnancy?
Yes. I have a story, okay? As a practicing physician, a patient came to me and pregnant, of course, the husband. So they asked that they do a proof of scan after everything, and then lo and behold, the scan report revealed that the baby was totally outside the uterus. It was an abdomen in the abdomen. It was actually strange because for ectopic, I never had an idea that I would really see it live, okay? And Peter Mitchell was referred to the general hospital here in Lagos, and they did a very good job. From beginning, they actually monitored.
So they allowed the pregnancy to advance.
Oh, yes.
Without any
complication. So, but of course, it wasn't. There was no way it was going to have a
normal delivery. No.
So it was actually the abdominal pregnancy, and they did surgery. They didn't even say they did surgery for the patient, and the baby is alive.
One interesting case of encounter was twin pregnancy. One in the uterus, one outside the uterus, and of course, with time, it was all about it is one baby, yes. And then something happened, started bleeding. So they lost the one outside the uterus, and so that is still alive. And so they are always telling him, you're supposed to be two, right? And so they gave him a twin name, despite the fact that it didn't come out as a twin. But that was just the prompt. We have in fact, a professor who is going to deal with this very important topic, because some people have experienced it, and it doesn't only just cause physical or financial complication. The emotional aspect of it is also very key. We'll be right back after this timeout. Do stay tuned. Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today's topic is on ectopic pregnancy, the causes, risk factors, diagnosis, management, and of course the prevention. And with us in the studio is an amazing, brilliant, working encyclopedia. And of course, there's no other person you could come to deal with this topic. It's no other person than Professor Anthony Akinloye Bamigboye, who is the MD CEO of Louis Med Specialist Hospital. Prof, you're welcome.
Nice, Doctor,
and you look dashing as usual.
Thank you so much. Thank you. Nice having me here.
Thank you very much, Prof. This is a sensitive topic. We've had, earlier on, you heard us talking about a case where the parents still held on to. Look, it was supposed to be a set of twins. One, we lost that one. Anyway, we still have one, and we are going to name him, give him a twin name, and even if the baby is not alive. So it's good for us to even let people know. Those are curious, our viewers, and that's the reason why we have them. They've been amazing. What ectopic pregnancy really is.
Ectopic pregnancy, thank you once again, is a condition where the pregnancy, which is the embryo, is implanted outside of the womb, anywhere outside of the womb. It could be in the cervix, it's a form of ectopic pregnancy. It could be in the fallopian tube, it's a form of ectopic pregnancy. And it can also be in the abdomen, in the empty cavity there, the intestinal abdominal pregnancy. So that's what we call ectopic pregnancy.
The one that you talked about, fallopian tube, yes, is one can understand. And the one that is abdominal,
the abdomen not even bigger than the fallopian
Yes.
tube. You know, because that one can even
The
accommodate the
connection.
baby.
I'm just thinking about the connection.
Yeah.
How?
How does that
How
happen,
does it
sir?
really happen?
What happens is that we have ectopic pregnancy initially, then it's ended up as tuber abortion. So the baby, which is the embryo, now transplanted into the abdomen
And started from
and started growing on the intestine.
That
Wow.
baby like say, look, I
Abdomen.
must come to this
I
watch.
must leave.
I must leave. I'm coming.
Those are the things.
That makes sense.
So it's a
So there was
tuber
a tuber
abortion. That was a tuber
abortion.
abortion most of the time,
continued.
and continues like,
Wow.
like that.
And refuse to say, look, oh, I'm not
Exactly.
going. I'm coming to. But those
Exactly.
kind of pregnancy, is the woman likely going to know that, look, I'm pregnant from inception?
Oh yes, because the hormones of pregnancy
Will be there.
are still being secreted
Yeah.
by the placenta.
Okay.
Whatever it's implanted on is still
So it's
going
going,
to
the
secrete.
placenta will plant in
Will
the
be
abdomen.
planted on the most of the time on the intestine or the liver or wherever it is hanging there. It will be there.
This is-
Yeah. So those babies are really stubborn babies.
Stubborn
who don't
babies.
Want to
Like I'm
avoid
really
coming
coming.
Yeah.
So, sir, what can cause ectopic pregnancy?
There are a couple of risk factors in ectopic pregnancy. We know for sure that age is a big factor. Most of the ectopic pregnancies that we see will be women who are more than 40 years old.
Oh, so
Yeah.
the older you are, the more at
more,
risk.
yes. The cilia, which is the proportion of it's called cilia, that propels the embryo,
embryo.
is getting weak when you are getting old. So
Okay.
they are not as effective as that. So the fetus now stays in the tube instead of moving down. Because in fact, all the time, egg gets fertilized in the tube. People don't know that, not in the womb. So when it does that, then it moves downwards to get implanted in the womb. You know, it's like what we do in IVF, to put the baby back in the womb. Okay, not in the fallopian tube. So when we have ectopic pregnancy, which can occur any region, anywhere in the abdomen, then it's not good for the baby, and neither is it good for the mother.
Okay, so before you talk about the signs or what the patient should expect, which one is the enterotopic pregnancy?
Heterotropic pregnancy is what the anchor said earlier on. Dr. Memuna said a case whereby a woman got pregnant in the tube and got pregnant in the womb. So the one in the tube has to be sacrificed, and then the one in the womb was growing. So the one in the womb was named a twin, a son or Taiwo or whatever it is.
Exactly.
You see, and the other one was taken out and dead. So that is heterotropic pregnancy.
Something that is extreme. We just talked about the abdominal one, pregnancy, which is also an ectopic pregnancy. And Memuna also gave instances of an instance of the one that was in the tube and the one that was in the womb.
Yeah.
Is there a possibility? I'm just thinking out loud.
Yeah.
Is there a possibility where you have a situation where the one in the tube also aborted and started growing in the abdomen, then the other one in the uterus?
See, we have a saying in medicine. There's never in medicine. Never say never. Okay, it's possible. That is just hypothetical. What you have just described, but it's very rare. I've never seen such personally, whereby there's a fetus growing in the womb and one in the abdomen. Yeah,
they're so close, right?
They won't.
Definitely.
One will shrink, one the other out, causing prematurity or whatever it is.
Okay, so let's talk about the signs.
Yes, before I move on, let me talk a bit more about the risk factors. I was talking about the age. The age was the big factor. Then women who are on progesterone contraceptive.
Progesterone only.
Progesterone only contraceptive. Because most of the contraceptive that we use is both progesterone and estrogen. Progesterone, what it does is that it makes the soft muscles relax to cool down, cool the temper, so that it's not able to propel that fetus, the embryo, out of the tube into the uterus to get implanted. So that is a risk factor. So if a woman gets pregnant while on progesterone only contraception, then one must be careful to ask to specifically look for
For
the
ectopic pregnancy.
ectopic, you know. And then we have other risk factors in women who smoke. Come on, if you
Smoking
smoke,
has come again.
do not fall pregnant without planning it, because you are not allowed to fall pregnant, because if you do, you may end up with ectopic pregnancy.
Really? What the
How does it,
correlation?
that thank you very much for asking. The correlation there is that when you smoke, you inhale the toxins, or whatever
Yeah,
it's called,
nicotine and
yeah,
all the other
nicotine
things.
and the other things. Then it goes to the fallopian tube, to the uterus. So the cilia, the finger-like structure
It's
that
on
propels the egg or the
egg.
embryo,
Mm.
uh, they are not there. They are damaged by the smoke.
Oh.
So by that way, the ectopic arises.
It can also be a cause of infertility.
Oh yes, it is. Of course, it's a major cause of infertility.
What of passive
So,
smokers
oh yes, they are at risk as well.
as active?
Yeah, at risk. And as long as the smoke gets into your system, you are at risk.
But there's a newfound one of smoking now. There is a shisha. Shisha and
Shisha,
also, yes, is that
it's very common in
yes,
in my area where I live.
yeah,
It's
it's
like
very
a
common
person,
these days,
even
yeah.
10-year-old, they just put
Exactly.
shisha on their
Is
mouth
that
and
also
breathe.
not a risk
Of course,
factor?
it is a very high risk factor, because shisha, you are actually inhaling a lot of nicotine.
Okay, so
Okay.
talking about the signs and symptoms, is it okay to break it down to the early signs and the late signs?
Yes, it is possible, but I must also not fail to mention the role of intrauterine contraceptive devices.
Okay.
IUCDs.
So like that's a
Women
risk factor
is a
too.
risk factor. So if a woman falls pregnant while on IUCD,
IUCD.
look out for ectopic pregnancy. The presenting features, a woman who has missed her period, they will say, but that is not exclusive of it, because a woman might not miss her period. They will tell you, I've never missed my period. I'm not pregnant. You say, "Well, you're pregnant." No, I'm not. It becomes an argument. I leave them alone. I don't argue too much. I just go ahead and show them, look, this is the on the scan.
On the scan.
This is the fetus. This is the womb.
Into IUCD.
Let's say you were pregnant. No, I never had intercourse. I didn't miss my period. It becomes family issues.
Oh,
Especially
wow.
when the husband is on leave. I saw a man
Oh.
who was at UCH for some eye operation, and the woman was left at home, then became pregnant, and now the problem now. I was not at home. Why? How come this woman is pregnant? So it was a big thing. So we see a woman who has missed her period, but it doesn't mean that they will always miss. Some will not miss. Some may be spotting, and they think it is period. So I would ask, have you missed, or is your period normal? Or is there a change in the pattern of your period? So if they say that, then it's so easy for me to say she might have had intercourse, she might have had also ectopic. If a woman misses her period and she's having pain, abdominal pain, then it's a warning sign.
It's a very sign.
Yeah.
So it's good that you are elaborating all the risk factors for us, smoking, age of the woman, the older, the more at risk, women on progesterone only, IUCD and all that. Before we go into the signs and symptoms, let's go out there with keeping up with the physicians. And of course, let's hear from you. Have you ever heard of ectopic pregnancy? Have you ever experienced it? You have a neighbor, a colleague, or somebody who has experienced ectopic pregnancy around you? What do you even know is ectopic pregnancy all about? We'll be right back after this time, and do stay tuned.
Ectopic pregnancy is broad, so I think I should maybe describe how pregnancy occurs. So eggs are released from both sides of the fallopian tube into the uterus, and that's where fertilization takes place and the baby grows inside the uterus. But for ectopic pregnancy, the egg does not release into the uterus. The sperm meets the egg inside the fallopian tube, and then the baby starts growing there. And the fallopian tube is very narrow, that actually cannot contain a baby. So that becomes an ectopic pregnancy that ruptures or is taken out. So if you don't detect it on time, it ruptures and can actually kill the mother. But when it's noticed on time, say in the space of 1-2 months, it can be taken out, and then the tube itself will be removed. And so for a woman that has 2 tubes, sometimes people get 2 ectopic pregnancy and then both tubes are removed. So basically that's what ectopic pregnancy is.
Welcome back. With us in the studio, we've been having an amazing discussion by Professor Anthony Bamigboye, who is the MDC of Louisville Specialist Hospital. He's a consultant obstetric and gynecologist, and we have been talking on ectopic pregnancy. Before we went on break, he told us that the people that are at risk of ectopic pregnancy, if you're getting older, like women 40 years and above, if you smoke, whether you are active smoker or passive smoker, you do shisha, you are more at risk. If you use progesterone only contraceptive or the IUCD type of contraceptive, these are some of the risk factors that we've been talking about when it comes to ectopic pregnancy, which just literally means pregnancy outside the womb, any part of the body but not in the womb. And Prof, we are back to talking about the signs and symptoms.
Yes.
Do we know?
Thank you once again. One of the signs that a physician or health caregiver would see that may warrant somebody thinking of ectopic is when you see an appendiceal scar. Appendix. No, what does appendix?
Exactly. What is
appendix?
What is that?
Ectopic. Well, it is very interesting. Not many people will think of it, but we think of it a lot. And studies have been done that people who have got appendicitis in the past, they are at risk of having ectopic pregnancy. That's why ectopic is more on the right than on the left. Yeah, because of the appendix. Appendix is on the right. So what happens is that we have inflammation of the appendix. When you have that inflammation, they go to the fallopian tube on the right, and then the cilia are damaged. So the ectopic then is found more on the right.
Slows down the movement of the egg into the
exactly.
womb.
So the embryo is stuck in the tube, and you have ectopic pregnancy. So those are one of the signs. Then, of course, you can have a positive pregnancy test. That is also, a sign. Then the symptom is what you have said. They may feel collapsing. They may have feel pain. They feel dizzy because of blood loss. Because the advanced ones, they are bleeding inside.
They have a tender abdomen.
You have a tender abdomen.
It's a medical emergency.
It's a medical. In fact, it's one of the greatest emergencies in obstetrics and gynecology. In medicine, there's heart attack. There's ectopic pregnancy. There's shoulder dystocia. Those are the emergencies that, oh my God, this thing is here. Whatever you are doing as a physician, stop. And I must warn our doctors as well. If a doctor has a premonition, oh, this one might have ectopic, don't do too much. Try and do your test if you can. If you are still not sure, go and operate. Okay. It's better to have a negative operation. You operate on a woman who doesn't have anything than to leave a woman who has got ectopic alone. Because you are going to end up killing that woman. That you think has not got, and you go home and take this.
So you may just rupture and the woman will just die. So
that's why I will never blame any of my doctors if they fail to diagnose ectopic. Yeah, high days of suspicion is what we need for ectopic pregnancy.
So what I would from talking about the signs and symptoms, we can actually draw complications from there. So what are the possible complications apart from blood loss and probably going into shock?
Well, the greatest complication is dying. So you're going to die. So that is the extreme. But apart from that, if you have an ectopic pregnancy, the chances that you have a repeat ectopic is common.
What?
In future.
Wow.
So a
woman can have.
It's about 4 to 10 times more than somebody who doesn't have. So that's a sign. Then infertility is another issue. Okay. Infertility. look, it means your cilia are not working in the tubes, so you may not be able to be pregnant. Then thirdly, you are going to operate on the fallopian tube. You are taking it out. It means you have lost one tube. The other tube is probably also going to be sealed. You see, so infertility would then come in as an issue.
So
Yeah.
how do you manage this kind of case?
Management of ectopic pregnancy. Well, there's some medical management.
Okay.
Then there's surgical management. Surgery is extremely common because medical is expectant, whereby there's a baby growing, there's an embryo there. The aim of your management is to kill the embryo so that it doesn't grow and cause a rupture of the tube. But some of the doctors are hesitant, like myself. I don't do such things. I would not want to kill the embryo. I better operate and get it done with, because it's a gradual process of killing. We use a drug called methotrexate. Methotrexate is used for cancer. It's a cancer drug which kills cancer cells. So now we use it in women who have got ectopic. So as to kill the baby, you kill it off, then there's going to be a tubal abortion or whatever abortion, and the baby lies mummified. They get it out of the system. You see, then that's one. But then you have to be careful. Then if you are doing medical, after you have injected that drug, you do a follow-up. You do your beta HCG or the pregnancy test serially. So the woman has to come in and come out, go in. And go. They don't like that. A woman who dodges from the husband who went to UCH for eye operation and they come back and say that she's pregnant.
Yeah.
She also didn't want him to know. So the earlier you sort it out, the better. That's one. Then two, you approach the surgical team to take out this aberrant pregnancy in the fallopian tube. And that you do by taking out the tube contained in the you can take it out, the old tube, or you can do what you call sapingostomy. Sapingostomy is when you create a hole in the tube, and then you drag that.
Sap it out.
Yeah, you suck it out, and then the thing then heals. The danger with that is that when the fallopian tubes are healing, you cannot guarantee that it will not bleed.
Okay. So before we let you go, I want you to just allay the anxiety of most of our viewers out there. With ectopic pregnancy, you also already talked. We know it's a cause of infertility because only one tube, only one ovary, both would be functional. So let them know that there's still a possibility of being pregnant, because instead of ovulating every month, will the patient still ovulate like that? But now it becomes like 50%, right? The chances of being pregnant is reduced. So what next after an ectopic pregnancy?
Okay, I think there's going to be counseling, but it has to be evidence-based. Evidence-based in the sense that you tell the lady that, look, for you to be able to fall pregnant, you need only one fallopian tube.
Exactly.
And you need only one egg. And then you actually need 1/4 of an ovary for you to be pregnant. And then we have two. So taking out one is nothing special. I have seen cases where a woman got 2 ectopics, but luckily the ovary was conserved, probably did sapingostomy, and became pregnant 4 times after that.
Whoa.
She had 4 babies. No, I followed her up while I was in the UK throughout that period, and then that was it.
So please kindly make sure that if you ever want to get pregnant, or you want to marry and have babies, try as much as possible to choose healthy lifestyle in ensuring that you are less at risk of having ectopic pregnancy. My name is Dr. Mimuna Isukadri. Until next time, remain blessed.
And for our viewers out there, I want to say thank you again for being part of our program today. You have heard it all from what the Prof actually talked about. One thing that I want you to go home with is early detection. Try as much as possible to attend your antenatal. It is very, very important. If you attend antenatal, they will be able to detect anything that is abnormal from the beginning, from the onset, and to be dealt with. Follow us on our social media platforms if you want to be part of this program. You can always just send us a mail. Go to our website, which is up and running. Send us a mail and we'll be invited. Again, I say thank you for being part of our program. Ensure next time you don't watch it alone. Call your family and friends to be part of it, to benefit from what we have to share, because your health will always be our business. Till next time, stay blessed.